Hi, and welcome to Silver Linings. Silver Linings is a human interest show, and I'm your host, Jackie Reid. Today's guest is Mike Dabbs. He's the president of the Brain Injury Association of Michigan. And Mike, nice to see you again, and thanks for being here.
Well, thank you, Jackie. It's great to be with you.
Okay. This time of year, we, see so many accidents, especially motorcycle, boat races. We just thought it would be nice to find out more about brain injuries and what the Brain Injury Association of Michigan has to offer the general public.
Well, indeed. You're absolutely right, Jackie. I think a lot of folks don't really understand how prevalent brain injury is. And that's what led to the formation of the Brain Injury Association of Michigan and actually our national association, the Brain Injury Association of America, nearly 25 years ago. And I think perhaps the best way for you and for your viewers to really grasp how, if you would, how new an injury, brain injury is if you think back to the day Jim Brady was shot, President Reagan's press secretary. And it was really when he was shot and survived the shooting and then had to go through rehabilitation, was really the beginning of brain injury rehabilitation as we know it today. And so with that, family members, survivors of brain injury started to come together and really talk about what the needs were. And that's what helped us become an association. And so we're here to provide support, education. We also assist with encouraging research in brain injury, as well as advocating for people with brain injuries. And like many other nonprofit organizations, we also have prevention programs.
Now, how did you get involved with the Brain Injury Association, Mike?
Well, I have had, when I started nearly 13 years ago with the association, I had at that time about 20 years of nonprofit management experience. And interesting you should ask that question because I was asked a similar question when I was interviewed. And my response was, gee, I don't think I had any loved one or anyone close in my family who had sustained a brain injury. But I thought I could perhaps help the association grow as a nonprofit with my experience. Well, lo and behold, I would say within a year of joining the association and learning more about brain injury myself, I realized that some of the issues that my father had as I grew up perhaps had been related to a brain injury. And just a couple of years after that, it was confirmed when he had had some health issues and had an MRI and a PET scan that the doctors noticed that he had sustained some injury to his brain and asked him if he had ever remembered being knocked unconscious or sustaining a blow to the head. And he said yes, he did. When he was a teenager, he was ejected out of a car in a car crash. Of course, this was back in the 20s, late 20s, early 30s, when seatbelts weren't in cars. And then again, during World War II, he was a World War II veteran, been in Guadalcanal and was part of the 2nd Marine Division that landed there and had been knocked unconscious during the bombardment of Guadalcanal. And interestingly enough, the issues that I remembered my father having as I grew up related to those areas of the brain that they identified as having been injured. And so lo and behold, I quickly learned that it very much did impact me. And so now it became even more important to me to do something about brain injury.
Yeah, I think most people get involved because a family member,
indeed,
has sustained some type of injury. I think you brought up a good point too with your dad possibly having 2 brain injuries, is that, as you sustain more than one, the symptoms multiply after a while. Yeah. And, it's like a ball rolling downhill.
That's right, Jackie. And I think the other thing that a lot of folks don't understand is that about every 23 seconds here in America, someone sustains a brain injury. About 1.4 million people every year have a brain injury that will cause them to go to the hospital. And unfortunately, upwards of 50,000+ of them will die because of that injury, but about 100,000 will survive it. But the injury will be severe enough that they will have a permanent disability for the remainder of their life due to that brain injury. Mm-hmm. Well, if you do the math, what it works out to is about 5.3 million Americans today are living with a disability due to a brain injury. And that's about 2% of the U.S. population. And that's more than almost any other known disability or chronic illness that's out there.
Yeah, and the one thing about brain injuries is that you can't tell really somebody has one by looking at them. Everybody, pretty much, unless it's a severe brain injury, looks pretty normal.
You know, that's absolutely right. In fact, for that reason, it's often been referred to as the silent epidemic, just because it is a chronic illness or chronic condition that is almost unnoticeable to most people. Mm-hmm.
Now, what do you do in your normal job, Mike?
Well, it's basically our state office has myself and 3 others that work there, and we are quite busy trying to provide support to people that call in on our toll-free number and help provide them with the information and education that they need to get services. It may be trying to locate a therapist, or perhaps trying to find a case manager or attorney, or even a doctor in some cases, to help understand their conditions, to getting necessary services from the Department of Human Services, or what used to be called the Family Independence Agency, or other state agencies like the Department of Community Health. So that keeps us quite busy with that. We also are quite involved with some public policy advocacy in Lansing. Specifically, as some of your viewers may know, the motorcycle helmet law, the legislator is considering repealing that. And so we're fighting that along with the insurance companies to try to prevent that repeal. And then we have prevention programs that we work on, as well as we have 20 chapters and support groups around the state to help provide support to the individual families as well.
You know, one of the things I wasn't sure about is, do you tell people where they can go for financial help? Is that part of your services?
You know, we do, to the degree that there are financial services available to them. Here in Michigan, we're really fortunate in that you know, about almost 50% of all brain injuries are auto-related. And here in Michigan, we have an auto no-fault insurance system that is truly the very best in the country. And a person who is injured in a car crash and sustains a brain injury can receive, for the rest of their life, medical care if needed. And they can also get replacement services for issues that they may have that they can no longer do for themselves through their auto no-fault insurance system. Unfortunately, in other states, they would fall to the Medicaid system. And here in Michigan, as I say, half of the folks are taken care of with auto no-fault, but the other half, then we try to assist them with how to qualify for Medicaid if the case, you know, is such that it would permit that.
Okay, I know before the cameras started rolling, you and I were talking about motorcycle insurance. Yeah. And I guess if anybody's listening who has a motorcycle, one of the things they need to be aware of is it does not cover bodily injuries in case they're in an accident.
But with motorcycles, here in this state, and this has happened in about almost 30 other states across the country, there's a very vocal minority group called ABATE, and they absolutely want the right to choose to ride a motorcycle without wearing a helmet.
Mm-hmm.
And in fact have been able to get the law repealed in, as I say, almost 25 plus states across the country. But what isn't being told is the fact that, number one, it is a small minority group that wants this. Here in Michigan, 2 surveys, one 2 years ago and one just this February, have indicated that upwards of 78% of Michigan voters don't want this law repealed. And yet our legislators appear on the verge of doing so. Furthermore, the National Highway Traffic Safety Administration, or NHTSA, the federal government's watchdog agency, has just released a report where in Florida, they watched what happened for the 3 years following the repeal of the helmet law in Florida. Well, not surprisingly, deaths increased 3 times as many. The number of catastrophic injuries increased over 3 times as many as what they had when they still had the helmet law. And they added to the taxpayers' burden because those people who did survive ended up on Medicaid. And in this day of strained governmental resources, to be flaunting the right to decide whether or not you wear a helmet at the sake of your loved ones and putting that expense on each of us as taxpayers is, in my judgment, just morally corrupt.
I have to agree with that. And I think, you know, when it comes to wearing a helmet, people figure that is their decision. And you're right, there's more deaths involved. These are not the people that I will see in my hospital and help with their rehabilitation. These people are just not going to survive, and that's a high price to pay for a little freedom. But, you know, we can't control what others want to do, but I understand the impact financially for taxpayers.
Well, it's financial, and I guess too, if that person who dies on that motorcycle is my loved one,
right,
and I'm left alone at this point, I mean, I would suggest that's selfishness at that point on their behalf.
Yeah, I agree. And you know, you talked about people going on Medicaid. Mm-hmm. I found out firsthand from some of my own patients that that's not as easy as it sounds. In order to go on Medicaid, you pretty much have to sell off most everything you own. You're
going to be pretty close to being destitute by
right.
the time you qualify, and even then, the level of service that you're going to get on Medicaid is nowhere near what you would need to try to rebuild your life again.
Mm-hmm. Mm-hmm. I agree. We're going to stop and look at a clip that you brought us. I'll let you do a quick introduction to it.
Okay.
And this, you know, fortunately, when I'm out and about driving, you see most everybody riding a bicycle has got a helmet on these days. Obviously, that's a personal choice too, but the clip that you brought, I'll just let you tell us about it, and then we'll take a look at it. And
quite honestly, this young teenager, as you'll see, taunts a young friend who also is wearing a helmet. The person doing the taunting, of course, isn't, and the results, I think, are rather vivid.
Okay, let's take a look.
Hey, that's a nice helmet you got there. Your mommy make you wear it? What's the matter? Scared you're gonna fall? You need some training wheels too? Hey, helmet boy, my sister's got a helmet like that. Maybe you should wear a dress just like her.
We're back after seeing the clip, Mike. I've seen it before. I saw it on the website. Mm-hmm. Very vivid clip, but very realistic. I think this is very much how children and even teenagers act among themselves?
You know, I think, Jackie, when perhaps some of your viewers who haven't seen this before are rather startled by what happens, and perhaps kind of wonder why we would even so graphically shows, you know, a young person seemingly being injured, and I can assure everyone that he wasn't.
That's good.
The fact is, it was a piece of styrofoam that was out the back of that truck that was made to look like a 2x6. So the young guy is just fine, I'm happy to report. But I think the key message there is it happens with the blink of an eye. And it happens in your own, literally, on your own street. It doesn't have to be the dramatic car crash or motorcycle crash or snowmobile or ATV or boat crash or any other of those more newsworthy type, you know, pieces that we'll see on occasion. It is benign as riding your bike. You know, and I'll tell you, Jackie, you made the comment earlier about you're seeing more and more kids wearing their helmets, and you're right, they are. They're getting the message. But yet, the thing that just amazes me at times is to see mom and dad so diligent about ensuring the child has got their helmet on, and they're going to take a little family bike ride, and meanwhile, mom and dad jump on their bike, drive down the street with no helmet on. Well, you know, modeling, as we all know, is critical to any person's development. Mom and dad have got to be wearing that helmet too, because I can assure you they can sustain a brain injury just as readily as what their young child can. So mom and dad, don't forget those helmets.
Yeah, I think parents forget that they're vulnerable to that. We think it's going to happen maybe to a child who's not paying attention, and certainly not to an adult who supposedly is tuned into everything around them.
Right.
So
exactly.
I agree with that. Now, why don't you tell me a little bit more about what the brain injury is involved in right now? And I know there's a very large conference coming up at the end of September.
Indeed. You know, this conference that we have here in Michigan will be our 25th year of holding an educational seminar, if you would, for both families who have loved ones with brain injuries, persons who have sustained brain injuries, as well as those that are working in the field of brain injury, from everything from nurses to case managers to doctors and others, and therapists are all in attendance. We've quite honestly have grown to have the notoriety of having the largest conference in the nation. It's a 2-day conference this year, September 29 and 30th. At the Lansing Center, which is Lansing's relatively new convention center, just 2 blocks from the Capitol. So we're really excited about having it. There will be a little over 1,300 people in attendance over the course of the 2 days, with over 31 workshops to attend and over 100 exhibitors to gather information from. So it's a wonderful opportunity for people not only to learn more about brain injury, but also to network with other family members, other persons with brain injuries, other professionals in the field of brain injury.
Okay. Now, does the Brain Injury Association do any research activities?
You know, unlike some of the other larger nonprofit organizations like American Cancer or American Heart, who've been around for many more years than have we, research is an area that we're becoming more active in, but certainly not doing all that we feel must be done. And I'm real pleased to tell you that here in Michigan, we've got some great research going on. Actually, starting at Wayne State University, which is one of the major model systems of care for brain injury rehabilitation. And they've been tracking some of the effects on the quality of life for people, and I sit on an advisory board with them and assist them with setting forth some of the criteria and studies that they will get into. We've also, because of a grant that the state of Michigan got, have done some really some cutting-edge research in beginning to understand Medicaid data and the types of services people that are currently receiving Medicaid but have sustained a brain injury are in need of. And the reason why that's so critical is because that, for the first time, it told our state leaders that over $37 million a year were being spent on people with brain injuries that they had no idea that they were spending that money on. And that will also assist us in terms of the public policy piece and helping our federal Congress people and senators understand the importance of brain injury and the impact that it has on our whole healthcare system.
Yeah, I think that's an excellent idea, because I think the awareness has to be at a higher level of state government too, because it's a big problem, along with some of the other health issues that you get into.
Absolutely.
But
you know, you mentioned awareness. Just a little over a week ago, I had a wonderful walkathon down at the Michigan International Speedway. And the thing that makes it truly remarkable is that the folks at the Michigan International Speedway work so closely with us. Actually, the public relations people from NASCAR and Charlotte came up and worked with us as well. And they were thrilled to do it. And one of the main reasons they were doing it was because of Ernie Irvan. And Ernie, who's, I think some of your viewers will immediately recognize his name as being one of the legends of NASCAR, one of the top 50 drivers of NASCAR, sustained not one, but 2 brain injuries, and both of them at Michigan International Speedway. And that's the reason it was important for Ernie to come back here and help lead this walkathon that we did of just 1 lap around the track. But boy, I'll tell you what, being out on that track and all of the folks, NASCAR fans and our family members and persons with TBI, who all came out. We had over 500 people there that day. And it was just a really, really special day. And Ernie is committed to raising awareness in this country about brain injury. He realizes he's been very, very blessed in life to not only have sustained the one, but both injuries. And after his first injury, unlike many people, he was able to return to racing and actually went on to a couple of more victories with his career before having the second injury here. And Ernie now realizes that he's got in his mind, he has a responsibility to try to raise awareness for brain injury. Okay.
Now, how is Ernie today? Does he still have some?
Just thrilled to death to see him be a spokesperson for the brain injury movement, because we haven't had one. We haven't had that Christopher Reeve who's been willing to step forward and say, you know, it's happened to me, it can happen to you, and here's how we can make a difference. But Ernie is that person who is willing to do that, and so we're excited about that at this point.
Okay. The reason I asked you about his progress is because I'm going to show another clip here, and it's an interview that's taken with actually a patient I worked with recently in the hospital, and his wife is going to tell us about the progress he has made so far and the obstacles that still lie ahead, because there are still some very large also financial concerns for him. So why don't we take a quick look at this film.
Great.
I wanted to welcome both you guys to the set.
Thank you.
And Sally, if you could just tell our audience a little bit about the injuries that Sandy sustained, the treatment he's gone through, and the obstacles you guys are still overcoming as a family.
Well, April 17th, he was servicing a motorcycle for a friend of ours. And he was in the neighborhood going down the street and decided that he was just going to take it out for a little test drive because it wasn't running right. And he didn't put his helmet on. And he took it down the street and it malfunctioned, as far as we know, and threw him off. And he was severely hurt with his head, and he was airlifted to the University of Michigan Hospital to help him. And There he was in ICU for 18 days. He had a couple broken fractured ribs, broken eye socket. What else did he have? I can't remember what else he had. Other things. And he stayed there, and he was moved to floor 4 for a week, and then up to the rehabilitation floor on floor 6, where he stayed for 2 months almost. And all the nurses and stuff to help him get better, and he had rehab, OT, and speech, and all that to help him with his brain injury. And he's doing very well right now.
Okay, I know I did take care of Sandy when he was at U of M Hospital.
Yes, you were one of his favorite nurses.
And to see him today, he has made dramatic improvements. There are still obviously some speech difficulties, word retrieval problems, but I know those have gotten substantially better over time. Do you know what his prognosis is for a full recovery right now?
We don't know. We won't know until a year, and then they can assess after that. They say what will come back and what won't, and what we have to work on. It's just a time thing. It's one day at a time, and we just keep hoping and praying that he's going to be back. And he's coming back.
Well, now, what did Sandy do in his regular occupation?
He's a heavy machine operator, and he's a master mechanic, and that's why he likes tinkering with motorcycles. That's one of his hobbies. He restores antique motorcycles and all that kind of stuff, and loves doing it. So.
Now, he must have done a lot of paperwork, because I know he loved to watch the nurses with their paperwork while he was at U of M.
Mm-hmm. He ran the jobs at work, a lot of the jobs. They build roads and parking lots and structures, and mainly roads, and he's a final grade man, so you have to be real precise and on the money when you do that.
So I just want to thank the two of you for spending some time and sharing Sandy's story with us. And Sandy, I look forward to getting more progress reports about you and seeing you when you're back to work.
Thank you so much. Thank you for your time.
Okay. Thanks, Sandy. And thanks, Sally, for being with us today.
Thank you.
Okay, we're back after watching that clip. That was Sally and Sandy Morrison. Sandy was a patient at the hospital I work at, which is U of M Hospital. I think what I wanted people to see is that they've gone through a lot to get to where they're at.
You know, that's so very true. They go through a lot, and they may continue to go through a lot for the rest of their lifetime, too. Even with a tremendous recovery, like we were talking about Ernie a few moments ago. But I would urge and just almost plead with viewers to understand that every single injury is different, and that the doctors, the medical staff have a tremendously difficult time being able to truly prognosticate how well the person ultimately is. And it's one of the key ingredients, as I think was apparent here, is it's the love and the support of the family.
We're out of time today. I want to thank you, Mike, for being here to our audience. If you want any more information, you can go to the website, which is www.biami.org. And thank you, Mike, for being here.
Thank you, Jackie.
And thanks, audience, for stopping by, and we'll see you next time.